Welcome back. September is Suicide Prevention Month and the fall semester is underway for college students.
And WMBD's Brianna Rittman spoke with several university counselors, and she joins us now from our Twin Cities newsroom to share what they have to say about suicide prevention for college students. Brianna.
Rebecca Durante, as students transition into a new normal away from family in college, mental health professionals want them to know that they have support. Take a look.
One of the biggest things that I often suggest to folks is just to recognize that we all experience transitions differently.
College can be a big transition for many, while also being the time when someone faces overwhelming situations outside of school.
We all experience, different types of crisis at different levels, but regardless of what it is, we all can kind of share in that experience of knowing that it's really, really hard to be in crisis and that it's also something that is relatively universal.
Unfortunately, trying to navigate a crisis can impact someone's mental health and result in suicide. According to the CDC, the overall number of suicide deaths increased by 2.6% in the United States. However, there was an 8.4% decline for people ages 10 to 24. Yet that age group makes up 15% of suicides.
Mental health has often been thought of like, well, there's mental health professionals, and so that's where you go. Mental health needs a community of care. We all should be invested in our own way to supporting each other's mental health.
University counseling professionals suggest students utilize resources on campus such as counseling services, student organizations, and academic advisors to help navigate crises and transitions. They say that having community helps prevent suicide because your community can recognize signs and recommend help.
Seeing some signs of withdrawal, social isolation are some of the most common things we might see with depression and or anxiety, changes in like eating patterns, exercise, socializing, sleep, absolutely changes in sleep, like you said, missing class, things that just seem like out of character for the person.
And if you're concerned that someone is considering suicide, simply ask.
I think as I've talked about this with students, some of the most common things I often hear of, well, what if I plant the idea in their head? And so I try to do a lot of education around that's not going to happen.
No matter the crisis, mental health professionals want students to remember a simple message.
It is okay to not be okay and to seek help. And you're not alone.
And in 2021, suicide was the 11th cause of death in the United States and the 15th in the state of Illinois. And if you or anyone is struggling with suicidal thoughts, help is available by dialing 988, which will connect you to someone with the crisis hotline. In the Twin Cities, I'm Brianna Rittman.